Hi, this is Eric Ruderman from Northwestern University, coming to you from RWCS on behalf of RheumNow. I gave a presentation this week on the current state-of-the-art in vasculitis therapy, and it's a pretty exciting time. We've been used to biologics for many of our diseases in rheumatology for the past 20 years, and in the last few years, suddenly we've realized which biologics work for which vasculitic diseases, and have made incredible strides. It all started about 6 or 7 years ago in treating ANCA-associated vasculitis with the publication of the RAVE trial that showed the benefits of rituximab in a disease where we had been able to manage people with cyclophosphamide, but a drug we never really liked to use because of the therapeutic window that was pretty narrow, the significant toxicity, and suddenly we had a drug that worked just as well, but we were more comfortable with because the toxicity level was lower. In the last 2 years, we've begun to see data on tocilizumab in giant cell arteritis, and there's another disease that we've been able to manage, but manage with high-dose steroids, which again, we're not terribly comfortable with, particularly in a population that's largely elderly and at great risk for osteoporosis and other steroid complications. And we've seen a recent trial that showed tremendous benefit with tocilizumab in reducing steroid use, in rapidly controlling disease activity. These new advantages have really changed the landscape in management of vasculitis, much in the way that we've seen in rheumatoid arthritis and spondyloarthropathies in the years before. What comes next? There are other diseases to approach, and what we really need to understand is long-term management of these diseases. So we can treat somebody with ANCA-associated vasculitis, but we know there's a huge risk of relapse in those patients. So we're trying to understand, do we keep them on rituximab? How often, for how long, and how do we decide when to stop? And I think we're going to face some of the same issues when we deal with GCA over time, patients who respond to tocilizumab, and deciding how long to continue treating them. Still a very exciting time, a lot to offer, and we're really looking forward to the next few years as we further these research agendas.